Maternal Health and SIDS Prevention in Northern California. Lakeisha Soames, Ann Stanford, Emily Valos, Michelle Van Ostrin, and Cara Warren. HCA 415 Community Public Health. Instructor Betsy Morthland. Sudden infant death syndrome, SIDS, also known as cot death or crib death, is a sudden death of an infant that is not predicted by medical history and remains unexplained after a thorough forensic autopsy and detailed death scene investigation. Infants are at high risk for SIDS during sleep. Typically, the infant is found dead after having been put in bed and exhibits no signs of having struggled. Here are infant death rates by race and ethnicity for the years 2007 to 2010. The cause of SID is unknown, but some characteristics associated with the syndrome have been identified and appear to interact with other characteristics. A triple risk model states that SIDS occurs when an infant with an underlying biological vulnerability who is at a critical development age is exposed to external trigger. SIDS prevention strategies include putting the infant to sleep on their back, a firm mattress separate from but close to caregivers, no loose bedding, a relatively cool sleeping environment, using a pacifier, and avoiding exposure to tobacco smoke. The Safe to Sleep campaign is considered a significant public health success leading to a measurable reduction in SIDS rates. SIDS was the third leading cause of infant mortality in the U.S. in the year 2011, and rates have been declining since 1988. Pregnancy and infant factors. Maternal age. SIDS rates decrease with increasing maternal age, with teenage mothers at greatest risk. Delayed or inadequate prenatal care, low birth weights. In the United States from 1995 to 1989, the SIDS death rate for infants weighing 1,000 to 1,499 grams was 2.89 in every 1,000. For a birth weight of 3,500 to 3,999 grams, it was only 0.51 in every 1,000. Premature birth increases risk of SIDS death roughly fourfold. From 1995 to 1998, the U.S. SIDS rate for births at 37 to 39 weeks of gestation was 0.73 in every 1,000. The SIDS rate for birth at 28 to 31 weeks of gestation was 2.39 in every 1,000. A lack of breastfeeding is linked to SIDS. Rates are suppressed when there are fewer than 20 deaths in a numerator, because the figure does not meet the NCHS standard for reliability or precision. Death rates and rates are suppressed when the value represents 0 to 9 sub-national events, in keeping with the data use restriction. Note that there may be slight differences in the number of infant deaths when comparing the linked births and deaths to the other vital statistics information. This next graph shows how the data could be significant in assisting with prevention and minimizing SIDS cases. Based on death records of California, the death rate per 100,000 live births was significantly higher in mothers between the ages of 15 to 19 years of age. However, the decline in infant deaths was significantly noted in mothers that were between the ages of 25 to 29 years of age. With this, it's basically data retrieved from records. There is the variable of economic situation, education about SIDS, and the environment surrounding the conditions in which the infant died that is not noted on the information provided by the death records registered. The factors of education knowledge of reducing SIDS is another unknown factor in this data collection. Of the above charts various programs and organizations such as California SIDS program. Such observations noted that the exposure to nicotine from parental smoke resulted in higher percentages of SIDS for infants of mothers who smoked during pregnancy. Education on placing an infant on his or her stomach to sleep resulted in higher increase of SID risk and generally was higher in infants between the ages of 2 to 3 months of age. Existing policies here in California include child care licensing rules required for facilities that have infants 12 months or younger, the NC SIDS laws, safe sleep policy, all staffs must participate in drills twice a year. Ongoing policy development include national laws in place for all child care facilities, non-profit educational seminars for caregiver parents and any facility employees involved with infants. Here are some of the implementations and actions of SIDS policies. Many states have laws related to SIDS. The laws vary significantly both in scope and subject. The definitions of SIDS varies from states to states in semantics. Most commonly, states have laws that provide guidance for coroners and medical examiners and set protocols for autopsies of SIDS cases. Many states also require that then an expert on SIDS participate in child fatality reviewing committees. In addition, several states have SID advisory counselors, education programs, and counseling programs. Still other states require data collection or research on SIDS. There are approximately 12 states that require specialized training for child care personnel and first responders. Specifically, the state of California has laws that relate to the medical examiner, the autopsy, require healthcare facilities to provide free information and instructional materials regarding SIDS, require first responders to receive specialized SIDS training, has a SIDS advisory council, and has a child health and safety fund in the state treasury with funding from the license plate program. One of the biggest campaigns to bring awareness to SIDS is the Safe to Sleep campaign, formerly known as the Back to Sleep campaign. Currently, there is no known way to prevent SIDS, but after many years of research, we do know that babies sleep safer when placed on their backs on a firm surface. Since the early 1990s, when the United States initiated the Back to Sleep campaign, the number of SIDS deaths has dropped by over 50%. However, in recent years, other causes of sleep-related infant deaths, including suffocation, asphyxia, and entrapment have increased. Sudden unexpected infant death is a term used to describe any sudden and unexpected deaths, whether explained or unexplained, that happen during the first 12 months of life. SIDS assurance in Northern California. California has laws that relate to the medical examiner. Autopsy requires healthcare facilities to provide free information and instructional materials regarding SIDS. Requires first responders to receive specialized SIDS training. Has a SIDS advisory council and has child health and safety funds in the state treasury with funds for the license plate program. Implementation of assurance policies include the enforcement of laws and regulations that protect health and ensure safety, linking people who need personal health services and assure the provisions of health care when otherwise unavailable, assure competent public and personal health care workforce, evaluate effective accessibility and quality of personal and population-based health services, research for new insight and innovative solutions to health problems. Part B of Maternal Health and SIDS Prevention in Northern California. The 2011 American Academy of Pediatrics recommendations have been expanded to focus on safe sleep environments that can reduce the risks of all sleep-related infant deaths, including SIDS. Infant care practices outlined in the expanded recommendations include placing infants to sleep on their back on a firm sleep surface, breastfeeding, room sharing without bed sharing, routinely immunizing infants, using a pacifier, and avoiding tobacco, smoke, and overheating. Since the implementation of the Safe to Sleep campaign, there has been a noted decline in infant deaths due to SIDS. Here is a chart, a rate of sudden infant death syndrome in California residents and in the United States, prepared by the California Department of Public Health Center for Family Health. This chart shows the breakdown of sudden unexpected infant deaths by cause in 2011. The majority of cases, 56%, were categorized as sudden infant death syndrome, followed by unknown causes at 26%, and accidental suffocation and strangulation in bed at 18%. Here is a breakdown by county of number of SIDS deaths, total live births, and SIDS death rates for California residents from 2010 to 2012. Blank cells indicate counties with no infant deaths due to SIDS. Rates continued. As you can see, every county here in California has a PHN as a liaison for the California SIDS program. In areas in California where communities' needs is greater, there is more than one PHN to handle the population's needs. Here is the Healthy People 2020 target reduction rates for infant death causes by SIDS. Sudden infant death syndrome and sudden unexplained infant death syndrome has occurred throughout time and has affected many societies, regardless of race, religion, financial or social standings, and geography. In California, it was reported that 164 infants died from SIDS in 2012. The number represents a rate of 32.6 in infant deaths per 100,000 live births, which is an increase of 1.6 from the previous year, 2011, which in turn was a decrease of 29% from 1999, when the SIDS rate was 45.7% per 100,000 live births. Showing that overall, not only did California meet the target reduction rate set by Healthy People 2020, it surpassed it by 3.1%. The assurance function. Part of the assurance function is to make sure that policies and procedures are being followed. Enforce. Example, in 2011, the American Academy of Pediatrics released a policy statement, SIDS, and other sleep-related infant deaths, expansion and recommendations for safety infant sleep environment, and an accompanying technical report. The Safe to Sleep campaign, formerly known as Back to Sleep campaign, aims to educate parents, caregivers, healthcare providers about ways to reduce risks for SIDS and other sleep-related causes of infant death. The safe sleep strategies outlined in Safe to Sleep materials and publications are based on recommendations defined by the 2011 AAP recommendations. Link available. Target outreach to MCAH population, other public health programs, and providers. Increase the knowledge of parents of newborn and child care providers, birth hospital, midwife. Discussion. Ask what sleep position they had as infants or they used with their babies. Talk about conflict with women in their 50s and older who were taught to always put babies to sleep on their stomach. Lecture, review, and discuss sudden infant death syndromes. Practice communication and policies regarding sleep positions and why to parents. Question answers. Respond to any questions that the group may have. Ask questions and emphasize important points that highlight the main concepts. In order to evaluate the effectiveness, accessibility, and quality of personnel and population-based health services when dealing with SIDS, short and/or intermediate objectives must first be set. After that, input is necessary as well as intervention activities to meet the objectives. The evaluation portion of the assurance function can take place. Performance measures should include process descriptions and measures and outcome measures. Develop and implement a continuous quality improvement, quality assurance process to monitor implementation of policy processes. A regular feedback mechanism is continually improve the process and evaluate the impact as well as provide technical assistance as needed. Policy development actions and existing policies. Both the CDC and the National Institute of Health collect info on sudden unexpected death from people 19 years and younger. The American Academy of Pediatrics, the educational website Healthy Children, Divisions of Reproductive Health, the DRH, investigates SID cases. The CDC research to improve collecting data and reporting of SUID, as well as SID state mandate California Department of Public Health. Training for emergency personnel and public health professionals. California Department of Public Health. To further assist with providing information as well as enforce regulations and standards to follow regarding SIDS, various organizations and programs have also become involved in educating the public as well. New policy development includes national law in place for all child caregivers and facilities, non-profit educational seminars for caregivers, parents, and any facility employees involved with infants, stakeholders, facilitators, governor support for SIDS law, California SID Advisory Council, 9-member state-appointed team, advises public health issues related to SIDS, and Dr. Thomas G. Keynes, SIDS researcher, holds the council chair. 10 essential services and SID prevention. The 10 essential services include 1. Monitor health status to identify and solve community health problems. 2. Diagnose and investigate health problems and health hazards in the community. 3. Inform, educate, and empower people about health issues. 4. Mobilize community partnerships and actions to identify and solve health problems. 5. Develop policies and plans to support individuals and community health efforts. 6.